Imagine waking up one morning and your vision feels blurry, your balance feels off, and a headache keeps coming back no matter what you do. For many people, these subtle signs are easy to ignore. But what if these symptoms are trying to tell you something important happening inside your brain? Brain tumors are one of the most misunderstood health conditions. They don't always start with dramatic symptoms, and many people miss the early signals until the tumor grows large enough to affect the brain's function. Whether the tumor is cancerous or non-cancerous, its pressure on the brain can change the way you think, walk, see, or even speak. Today's video will help you understand the exact reasons why brain tumors develop, the early and advanced symptoms you should never ignore, and the treatments doctors use in the United States, including the latest technologies. Watch till the end. This knowledge could save a life. Reasons for brain tumor. A brain tumor forms when cells inside the brain start growing abnormally and uncontrollably. This growth creates a mass that can be either benign non-cancerous or malignant cancerous. While the exact cause of many brain tumors is still unknown, doctors have identified several important factors that increase the risk and contribute to their development. One of the primary reasons is genetic mutations. These are changes in the DNA that control how cells grow and divide. In a healthy brain, cells follow a natural life cycle: grow, divide, and eventually die. But when genetic mutations happen, these cells lose their normal control. They begin to multiply faster than usual, forming a tumor. Some people inherit genetic mutations from their parents, particularly those with hereditary syndromes, such as neurofibromatosis type 1 and 2, Li-Fraumeni syndrome, and tuberous sclerosis. These conditions significantly raise the risk of developing various types of brain tumors throughout life. Another major factor is radiation exposure, especially ionizing radiation. This type of radiation is strong enough to damage DNA and is sometimes used in medical treatments like radiation therapy for other cancers. People who were treated with radiation in childhood or young adulthood for conditions such as leukemia or thyroid cancer have a higher chance of developing brain tumors later in life. However, everyday exposure, like from cell phones, microwaves, or Wi-Fi, has not been proven to cause brain tumors in scientific studies, according to experts in the United States. Environmental factors also play a role but remain less clear. For years, researchers have studied whether chemicals, pesticides, or heavy metals contribute to brain tumors. While no direct link has been confirmed, long-term exposure to certain industrial chemicals is still considered a possible risk factor. Workers in manufacturing, oil refining, or chemical industries may have slightly higher risks, although research is ongoing. Treatment for brain tumors. Treatment for brain tumors in the United States depends on several factors: the type of tumor, whether it's benign or malignant, its size, its growth rate, and its location. Doctors use a combination of surgery, radiation therapy, chemotherapy, targeted therapy, and supportive care to manage the condition effectively. The first major treatment is surgery. If the tumor is accessible and not located in a highly sensitive brain area, surgeons try to remove as much of it as possible. Removing the tumor reduces pressure on the brain and improves symptoms. In many cases, complete removal is possible, especially for benign tumors. For malignant tumors, surgeons may remove only part of the tumor if it is near critical structures. Even partial removal can still significantly improve recovery chances. After surgery, many patients receive radiation therapy, which uses high-energy beams to destroy remaining tumor cells. Modern radiation methods, like stereotactic radiosurgery, deliver highly focused radiation with accuracy, minimizing damage to healthy brain tissue. This technology is widely available in the US and is especially effective when the tumor is small or located in a hard-to-reach area. Chemotherapy is another important treatment. These medications target rapidly dividing cancer cells. Chemotherapy may be given orally, through injections, or directly into the cerebrospinal fluid. The effectiveness of chemotherapy varies depending on the tumor types. Some brain tumors respond very well, while others are more resistant. Temozolomide is a commonly used chemotherapy drug for aggressive brain tumors like glioblastoma. In recent years, targeted therapy has become more common. These treatments focus on specific genetic mutations present in the tumor. By blocking certain proteins or pathways, targeted drugs slow or stop tumor growth, with fewer side effects than traditional chemotherapy. Another advanced option is immunotherapy, which strengthens the body's own immune system to recognize and destroy tumor cells. While still under study for brain tumors, immunotherapy shows promising results in certain cases. Symptoms of brain tumor. Brain tumor symptoms are often confusing because they depend on the size, location, and speed of growth of the tumor. The brain controls every function in the body, so a tumor pressing on different areas can cause very different symptoms. Some signs appear slowly over months, while others develop suddenly and severely. One of the most common symptoms is a persistent headache. Tumor-related headaches typically worsen in the morning when you wake up because pressure inside the skull increases while lying down. These headaches may feel different from regular ones. They might be stronger, more mortiferous, or resist normal pain medicine. Some people also experience nausea or vomiting along with the headache. Another major symptom is seizures. A seizure happens when abnormal electrical activity occurs in the brain. Even people with no previous history of epilepsy can suddenly experience a seizure due to a tumor. Seizures can appear as full-body convulsions, muscle twitching, loss of consciousness, or even brief moments of staring and confusion. Changes in vision are another important sign. A tumor in or near the visual pathways may cause blurry vision, double vision, or partial vision loss. Some people notice difficulty seeing at the edges, which is called peripheral vision loss. This can be dangerous because it affects activities such as driving and walking safely. Brain tumors also affect balance and coordination. When the tumor is located in the cerebellum, the part responsible for movement control, people may feel dizzy, stumble when walking, or find it difficult to perform tasks requiring precise hand movements.